What is anemia? Anemia is a blood disorder in which the body has fewer red blood cells, RBCs, than normal, or has less hemoglobin in each red blood cell. As a result, the body's tissues receive less oxygen. RBCs carry oxygen throughout the body using a protein called hemoglobin. Anemia is not a disease itself, but a symptom of an underlying issue or malfunction in the body. It is one of the most common blood conditions, especially in women. Around 1 in 5 menstruating women and half of all pregnant women are anemic. Types of anemia. 1. Iron deficiency. Anemia. Most common type. Caused by lack of iron due to blood loss, poor diet, or pregnancy. Treatable with iron supplements and iron-rich foods. 2. Sickle cell anemia inherited disorder. RBCs become crescent-shaped, making them sticky and slowing blood flow. 3. Normocytic anemia. RBCs are normal in shape, but fewer in number, often caused by chronic diseases or infections. 4. Hemolytic anemia. RBCs are destroyed faster than they are produced. May result from autoimmune disorders, infections, or medications. 5. Fanconi anemia. Rare, inherited condition. Affects bone marrow and leads to failure in producing blood cells, birth defects, and increased risk of leukemia. 6. Megaloblastic anemia, MA. RBCs become large and structurally abnormal, usually caused by deficiency of vitamin B12 or folic acid. 7. Pernicious anemia, PA. A type of megaloblastic anemia, caused by vitamin B12 deficiency due to lack of intrinsic factor, which helps in absorption. Symptoms of anemia: weakness or fatigue, pale or yellowish skin, shortness of breath, dizziness or fainting, rapid or irregular heartbeat, palpitations, headaches, irritability, difficulty concentrating, cracked or sore tongue, loss of appetite, unusual food cravings, like ice, clay, etc. Causes of anemia. Anemia may be congenital, inherited, or acquired, developed later in life. Common causes include iron deficiency due to poor diet or blood loss, vitamin B12, or folic acid deficiency. Genetic blood disorders, for example, sickle cell anemia, thalassemia. Chronic diseases, for example, kidney disease, cancer, blood loss from ulcers, hemorrhoids, or gastritis. Bone marrow disorders that reduce RBC production. Risk factors: poor nutrition, lack of iron, folate, or vitamin B12. Gastrointestinal disorders like Crohn's or celiac disease. Menstruation, frequent blood loss increases risk. Pregnancy, higher iron and folate demand. Family history of inherited anemia, older age, decreased nutrient absorption, and chronic illness. Diagnosis of anemia. The primary test is a complete blood count, CBC, which measures red blood cells, RBCs, white blood cells, WBCs, platelets, hemoglobin, and hematocrit levels. Normal hemoglobin levels: men 13.8, 17.2 g/dl, women 12.1, 15.1 g/dl, children 11, 16 g/dl, pregnant women 11, 15.1 g/dl. If anemia is detected, further tests help identify the cause. Treatment of anemia. Treatment depends on the type and severity of anemia. 1. Iron deficiency, anemia. Iron supplements and iron-rich foods, like spinach, red meat, lentils. In severe cases, IV iron or blood transfusions. 2. Vitamin deficiency. Anemia supplements of vitamin B12, folic acid, and vitamin C. If absorption is an issue, vitamin B12 injections may be given. 3. Chronic disease. Anemia manage the underlying condition. May need blood transfusions or synthetic hormones to boost RBC production. 4. Aplastic anemia may require bone marrow transplant, medications, or blood transfusions. Key message: your health is your greatest asset. If you experience signs of anemia, get tested early and follow medical advice. Schedule your appointment today. Would you like me to convert this into a YouTube video script with voice narration cues and visual suggestions? It would work great for educational or health awareness content.